The ugly truth about nursing burnout. What is good, YouTube? NWA here, Nurse Pat, coming at you again with some heat. We got a great topic today suggested by this gentleman here. So we're gonna go ahead and talk about nursing burnout and stress and what I do not like and do like about my job. Unfortunately, it's very common to see nursing burnout, especially as a new grad nurse. Damn near all of my peers that I've graduated with or have started my job with have felt this way at some point. You're literally like, man, what the fuck did I just get myself into? When starting off, there's always going to be a steep learning curve and you're going to have a little bit of anxiety. But this holds true for pretty much any job you do. So it's not uncommon too that you'll hear people saying that they hate bedside nursing and they feel like it's not the profession for them. But what's very important is that you need to try out different units or different specialties or roles in order to say that you really do not like nursing. There's so much lateral mobility you could have as a nurse. That's what's pretty cool about things. You don't necessarily need to be at bedside if you don't like it. For instance, you got IR, you got OR, you could be a PACU nurse, you could be a cath lab nurse, you could even be like a cosmetic nurse, an infusion nurse, home health and hospice. There's so many different things you could do. You're not limited to one thing. So you might not like a specific unit you're at. So maybe med-surg and the geriatric population isn't for you.
I'm over 72 and I feel great.
I don't give a fuck.
But something like pediatrics or labor and delivery, you'd enjoy so much more. For me personally, I don't see myself long-term in the med-surg medical floor as a bedside nurse. However, at this time, I have no regrets because I personally see it as a stepping stone to grow and learn as a nurse. It does provide you the chance to build your fundamentals as a nurse, your time management and your prioritization. And also it kind of feels like a rite of passage, I guess you could say. So yeah, just because you're in a specific unit as your first job and you hate it doesn't mean that you should quit nursing altogether. You got to figure out what you like and what's for you, and only you could answer that. So now let's talk about some of the top things I don't like about my job. Honestly, I think the number one thing for me is like super rude patients and a lack of gratitude. I'd be seeing some privileged ass patients. It's annoying. And then some of them will just see you as like a servant and treat you as a servant rather than a professional. They think the hospital is a hotel. And you know, I get it, I understand, you know, even in nursing school, they tell you, you know, people in the hospital, they're not 100% and stuff. When you're sick, you're not in the best mood. I get it. But when you're out there stressing and you're struggling, you're already having a bad day. When you're just trying to help someone out and make them feel better, just to be shitted on is not a good feeling. The second thing that I would mention would probably be douchebag doctors that just keep yelling at you and are very condescending. Who passed you in your nursing classes? How did you pass the NCLEX with that type of knowledge? Don't ask me that again. We're supposed to be a team, you know, the interdisciplinary team is supposed to work together and stuff in order to accomplish helping the patient out. There is no need to treat people like that, but it is what it is. Some people just don't have any souls.
I have no soul.
Another thing I do not like is sometimes you're just so busy you can't have really meaningful patient-centered care because you're out there running around like a chicken with its head cut off, going to your different patients, doing different things and stuff. You're literally juggling around. You can't really have like meaningful conversations with people. You can't socialize and really get to know your patient, build that rapport, that trust sometimes because you're just going everywhere, you know? The last thing that I'd probably mention is when like your patient is suffering and you as the team, the doctor, the nurses, everybody are doing their best to help the patient, to help them recover, to heal them and have them comfortable, yet things aren't working and the patient is still suffering. It's not a good feeling because you just feel sort of powerless and stuff. And you know, it sucks that some patients are going through some tough things. So what are some things that I do like about my job and what keeps me going at the end of the day?
Good for your soul.
So the opposite of that first one would be the patients that show you gratitude. You know, like a simple thank you and stuff really goes a long way in my opinion, because when you're out there stressing, it lets you know that your patients, they really appreciate what you're doing. And especially during these times, you know, patients or family members, so they'll call you heroes for the situation with the COVID stuff and everything, because things are stressful times. Another thing that keeps me going is the thought of saving lives and making a difference in somebody's day. Sort of coincides with the first one, but I really feel like having a job where you could feel like you're making a difference is very important. If I were to just have a desk job, I would have trouble seeing how I, you know, contribute to the society. Another important thing that I like and keeps me going is that with this type of job, you'll learn valuable life skills that will take into play with the people you care about. So if there's any emergency situations or some urgent things, you'll be able to recognize what's going on, if you need to do some interventions, if it's something that you need to go to the doctors for or the emergency room for. So you could really make a difference and possibly save someone's life. And with nursing, the learning opportunities are endless. You'll learn something every day pretty much. And the last thing, of course, that everyone probably has to mention is the job stability, the pay, and the benefits. It's widely known that nursing is a great profession for these things, but if this is a primary reason why you want to become a nurse, you probably won't make it out there. So when it comes to burnout, it's important to have great stress management. So let's talk about that a little bit. You got to figure out what coping mechanisms work best for you and not to choose things that are detrimental to your health. For me, it's working out. Fitness is something that I'm very passionate about, and also chilling with people that I care about. You know, different hobbies you have, music,
43, 44, 45.
Hiking, you know, dancing, whatever you want to do that makes you feel like good about yourself and is fun, I think is very important, because you can't just be a slave to your job and stuff and you're just dreading the next day because you gotta go to work. So here's some random pro tips that I do too. Dark chocolate is a godsend. Either pure cacao or super high percentage dark chocolate. It's not gonna be that sweet crap. So dark chocolate or 100% cacao has an amino acid called L-theanine, which is shown to decrease your anxiety levels. And then dark chocolate is also shown to increase serotonin levels to boost your mood and help you feel better. It also helps increase your sharpness and focus. And then it also has theobromine, which is an amino acid there that will help you satiate yourself and keep you less hungry. Because if you're out there working and you're hungry, you're gonna be hangry. And that's me too. If I'm like hungry and I haven't had my break.
You're playing like Betty White out there.
That's not what your girlfriend said.
Baby. Better?
You're not you when you're hungry.
Can I get a cup of coffee? Black? Can't you see we talking? White?
You're not yourself when you're hungry, and that's a fact. So I like to eat some dark chocolate before I go to work. Another thing is, if I had a shitty shift, shitty day, I like to have like healthy ice cream that I don't feel guilty about. So like Halo Top, Proyo are some good brands that I've tried. Whatever you feel that is good. I feel like it's a means to help eat something sweet and like tasty while not feeling guilty at the same time, because binging in that regard is technically an unhealthy habit and you'll gain some weight. So overall with this video, the takeaway is that do not be discouraged by everything. I do believe that the struggle of nursing and what you will go through is worth it, and I think others will agree as well. You just got to figure out for yourself what you personally like and what works best for you. So I hope you guys like this video. I hope it helps out. Let me know if you like the content by commenting, subscribing, and liking the video. I'm doing my best to try to get around one video a week, so stay tuned. Everyone out there, stay safe, stay humble. I'm out.